We're going to go over spinal anatomy, and we are going to begin with the bony and ligamentous structures and build up from there. And you can see how intricate and complicated this is, and here we're just essentially looking at the bony structures and some of the basic ligamentous structures. You can see the interspinous ligament transitioning into ligamentum nuchae, and overlying the interspinous ligament you can see the supraspinous ligament, which is essentially just over the spinous processes. You can appreciate the intervertebral discs, and you can also appreciate the facet joints with the capsule overlying the facet joints, except there's no capsule at the L5-S1 articulation. Also, there are multiple layers of muscles around the spinal column. Here we can appreciate the lateral intertransversalis muscles as well as the intertransverse ligaments. Here's the close-up view. You can see those facet joints with the overlying capsule. And now we're rotating, and we can appreciate the ligamentum flavum, which connect the lamina of adjacent vertebrae, and they're the thinnest in the neck and progressive thickness towards the lumbar spine. Also, we can appreciate on the sacrum the superior articular process that's articulating with the inferior articular process of L5. Here we're getting a close-up of the posterior sacral foramina, and here is a close-up lateral view of the spine. Again, you can appreciate the intertransverse ligaments as well as the lateral intertransversalis muscles. Now we're moving up the spine. You can see the end of the spinal cord, otherwise known as the conus medullaris, and not depicted here is the cauda equina. Here is one of the vertebral bodies removed. You can appreciate the end plates of the vertebral bodies. Now we're looking at the articulation of the rib with the spinal column. You can appreciate the lateral costotransverse ligament as well as the superior costotransverse ligament. And now we're moving cephalad, and here you can appreciate the thyroid and the cricoid cartilages. And also you can appreciate how each vertebrae within the cervical spine is quite distinct, especially C7, which has the longest spinous process. We are now from a bird's eye perspective, looking at the capsules of the atlanto-occipital joint, which were just removed. You can appreciate the dens and some of the ligaments, including the apical ligament of the dens, as well as the alar ligament of the dens, as well as the deeper part of the tectorial membrane. Also appreciate the spinal cord and the ligamentum nuchae, which is an extension of the interspinous ligament. Here we are now laterally. You can appreciate the facet joint capsules, ligamentum flavum, also the thyroid cartilage and the cricoid cartilage anteriorly. And now we're going distally down the vertebral column. We can appreciate the intertransverse ligaments again. Here we're looking at the vertebral column from a close-up lateral perspective, and now we're rotating posteriorly. We can appreciate this very fine, intricate muscular network of the multifidi and the rotators muscles, which probably fine-tune certain movements of the vertebral bodies with one another. Now we're going distally. Again, you can appreciate ligamentum flavum, the facet capsules, and the intertransverse ligaments, as well as, again, the interspinous ligament and the supraspinous ligament. Here's the quadratus laborum muscle. Here again you can see a close-up view of the deep multifidi muscles. And you can also appreciate the posterior sacral foramina. And now we're adding another layer of multifidi muscles, which are essentially the mid-multifidi muscles over the deep multifidi muscles. You can also appreciate the sacral hiatus. You can see how the supraspinous ligament kind of fans out over that sacral hiatus. You can also appreciate the obturator foramen, the ischial spine, and various bony landmarks on the pelvis. Here again is a good view of the quadratus lumborum muscle, part of that deep core musculature that everyone basically tries to strengthen to help avoid and treat back pain. And here we're going up the vertebral column, and just shown on the right side is the spinalis cervicis muscle. Also, you can appreciate the interspinalis cervicis muscles, which go between the spinous processes. Here again, you can see some of the deep musculature of the cervical spine, as well as the ligamentum flavum, as well as the ligamentum nuchae, which is a continuation of the interspinous ligament. Also, you can appreciate the interspinalis surfacis muscles, which are these thin muscles going from one spinous process to the other, essentially in the midline. Now we're going down pretty quickly. We can appreciate quadratus lumborum as well as all the layering of the multifidi muscles over the sacrum. And you could just imagine when these muscles contract how they're causing essentially many different subtle motions of the vertebrae relative to each other. Now we're adding some of the larger superficial musculature of the back, such as the iliocostalis and longissimus and spinalis muscles, layering over the multifidi muscles. And now we're going proximally. You can appreciate some of the more superficial musculature of the neck and the upper back. Here we added, obviously, the skull and the clavicle. Also, you can appreciate the longissimus capitis muscle, which arises from the 3rd through 6th transverse processes of the cervical spine and attaches on the basilar part of the occipital bone. You can also appreciate the longissimus cervicis and iliocostalis cervicis muscles. And now we're adding yet another layer of musculature. We got the levator scapulae muscle going from the neck to the scapula. Also, you can appreciate all the different layering of muscles within the neck, not only attaching to bone, but also attaching to the thyroid cartilage. Here we're looking at some of the deep musculature of the neck, and we're rotating anteriorly. You can see how some of the deep anterior muscles of the neck, they attach to the thyroid cartilage. Also, the thyroid hyoid muscle goes from the thyroid cartilage to the hyoid bone. You can appreciate some of the muscles around the rib cage, including the internal intercostal muscle, as well as the transversus thoracicis muscles as well anteriorly. Also, you can appreciate serratus anterior. And now we're rotating laterally again. You can get a better view of the serratus anterior muscle, how there are multiple kind of slips of this muscle that attach to the very anterior medial aspect of the scapula, and any dysfunction of the serratus anterior muscles can result in winging of the scapula. Also, dysfunction of the trapezius muscle can result in winging of the scapula as well. Here's a close-up view of some of the larger musculature of the back, including the iliocostalis and the longissimus muscles, and also you can appreciate serratus anterior muscle as it's inserting onto that medial aspect of the anterior scapula. Now we're adding the serratus posterior superior musculature, a more superficial layer. You can also appreciate the levator scapulae muscle, as well as the posterior belly of the digastric muscle and the styloid hyoid muscle as well. Now we're rotating and we're kind of looking kind of at the base of the skull. We can appreciate the obliquus capitis superior muscle, as well as the obliquus capitis inferior muscle, as well as the rectus capitis posterior major and minor muscles. And now we're rotating again to appreciate the lateral aspect of the neck, giving us a good view of the myloid hyoid muscle, as well as the very long nature of the omohyoid muscle, which is interesting how it transitions into a tendon essentially in the middle of the muscle. And again, here's a good view of the anterior and posterior bellies of the digastric muscle, as well as the styloid hyoid muscle. Okay, and now we're kind of diving into the chest cavity itself. We can appreciate the anterior longitudinal ligament over the anterior aspect of the vertebral bodies, as well as the radiate ligament going from the ribs to the vertebral bodies. And here we can appreciate the inner aspect of the internal intercostal muscles. And here we're looking at the undersurface now of the sternum, where we can also see the transversus thoracis muscles, as well as the internal thoracic artery, as well as the intercostal arteries that branch off from that. And now we're rotating and we're back out of the chest cavity. And here we can appreciate this very complicated network of neurovascular structures that nourish and innervate all the different musculature of the shoulder, the neck, the upper extremity, and thorax. Here we are now rotating, and we're again looking at the axilla with all the complex network of artery, veins, and nerves. And now we're adding the sternocleidoid mastoid muscles. You can also appreciate the external jugular vein that overlies that muscle. You can also appreciate the scalene muscles and how the brachial plexus weaves its way through those muscles as well. Again, here's a closer view of the C5 spinal nerve that feeds into the brachial plexus. And here we are rotating posteriorly. Here again, we're looking at the posterior aspect of the neck, and now we're adding some of the more superficial muscles, such as the splenius capitis muscle. You can see the posterior aspect of the sternocleidomastoid muscle. Again, you can see serraceous posterior superior muscle, and overlying that are the rhomboid minor and major muscles, which were just added. Again, you can see how those overlie the pretty large iliocostalis muscles and longissimus muscles. Again, you can appreciate the multifidi muscles, and here is the trapezius muscle, a very large kind of butterfly wing shaped muscle that goes all the way down the spine and inserts on the scapula, and it goes all the way up to the superior nuchal line of the skull as well. And here we just added latissimus dorsi. You can appreciate how big this muscle is, going all the way down from the sacrum, attaching to the proximal humerus, just medial to the bicipital groove. And here you can see the trapezius muscle as well, how that overlaps the cephalad aspect of the latissimus dorsi muscle. Here you can appreciate the quadrangular space as well, where the axillary nerve and posterior circumflex humeral artery pass through. You can also appreciate the lateral long heads of the triceps muscle. And now we're rotating anteriorly. And here is pectoralis minor muscle as well as coracobrachialis muscle. And now we're adding the biceps muscle, both the short and long head. And you can appreciate how the short head is superficial to the coracobrachialis muscle. You can also appreciate the sternal branches of the internal thoracic artery. And here we're rotating again anteriorly. We can appreciate the very large pectoralis major muscle, which has both clavicular and sternal heads, again attaching on the proximal anterior humerus. Here's a good view of the acromioclavicular joint, looking at the trapezius muscle, as well as the external jugular vein overlying the sternocleidomastoid muscle. You can appreciate the anterior and posterior circumflex humeral arteries and veins, as well as a good view of the infraspinatus and supraspinatus tendons attaching on the greater tuberosity of the proximal humerus. Here you can see the deltoid muscle as well as the cephalic vein within the deltopectoral groove. Here again you can see the deltoid muscle. You can see how it overlaps the triceps muscle and attaches on the proximal anterior aspect of the humerus on the deltoid tuberosity. Also, you can appreciate the psoas minor and major muscles, which is part of the deep core musculature. Here we're adding the transversus abdominis muscle, which is the most posterior layer of the abdominal musculature. And also you can appreciate the inferior epigastric artery and the external iliac artery. You can also appreciate the superior epigastric artery and veins. And now we're adding another layer of musculature, which is the internal oblique muscle. And now we're adding the external oblique muscle. And now we're rotating posteriorly. You can see the large trapezius and latissimus dorsi muscles. And a theme which seems to be pretty relevant to anatomy is that the larger muscles are more superficial, and the deeper you go, you get these smaller muscles which essentially fine-tune movement. And now we're making the superficial layers translucent. We just made the rhomboid muscles translucent, and you can appreciate how complex this layering is of these muscles. And here we're making even some of the deeper layers more translucent, and now we're just looking at it from a fairly distant perspective, and again, just appreciating the complexity of all these different layers of muscles in the back. And you can just imagine how the interaction of these muscles is quite complex and really challenging just to determine and predict how the interaction of these muscles is with one another when one muscle contracts and another muscle relaxes. And when you think about how many different muscle groups are coordinated with one another, it gets very challenging. And again, just wanted to thank you for watching this tutorial. This is Dr. Scott Weiss from probeultrasound.com, and any feedback, please feel free to reach out. Thanks again.